neutral bay rooms, and young Christopher has presented concerned by his speech and also the crowding of his teeth. But Christopher's a good example of someone who has a tongue tie that should have been picked up much earlier in his youth. But because the tongue tie hasn't been addressed, it's had a negative effect on the palate. So what I'd like to show you is this article, and if you can come closer. So this was research at Harvard University, and we have Dr. Zaghi, who's a dual-trained sleep physician as well as sleep surgeon, I should say, and ear, nose and throat doctor. Audrey Yoon, who's dual-qualified in sleep and orthodontics, and of course the father of sleep medicine, Christian Gumino. And in this study, they showed that you could measure tongue tie one of two ways. The old way was the Kotlow measurement, which is from the insertion of the frenum into the tongue to the tip of the tongue, right? The more accurate method is what's called a functional classification. So we ask the patient to open as wide as they can, and in a minute you'll see Christopher has normal range of motion, which is 50, and then a patient should be able to keep their tongue up on the palate or raise their tongue higher than halfway. So if you look at these patients, that patient can lift not even half of the normal opening. So that's a grade 4. Grade 3 and 4 need the release. 2, if it's not causing problems with the palate or speech, you monitor. 1 is normal. And in this paper, they go on to say that the more tongue-tied, the more negative effect on the development of the palate. And when you see Christopher's palate, you see exactly what I'm talking about. So Christopher, you came to see me today. What are your main concerns?
I find that my upper teeth are resting on my tongue.
Yep.
And when I'm very conscious of it, I find myself mixing up my words and
Yep.
struggling to get the words out.
Okay.
And then often feel like I've been chewing on my tongue.
Okay.
Which is painful.
Okay.
most
So
of the time.
what we're going to do now is have a look in your mouth and kind of measure the width of your palate and also the opening and closing of the mouth as far as range of motion and also the position of the tongue. Okay. Perfect. Okay, so I'm now going to look in Christopher's mouth, and that's the ruler we use. That's in that article, and this gives me the range of motion opening. So you can see there's the tip that you place on the lower incisor, and you get the patient to open. So let's do that. Can I get you to open really wide for me? And wide as you can. You can see he's got good range of motion, up to 60 millimeters. Okay. Now try and lift your tongue up. And you can see he can't even reach a quarter of that with his tongue. Okay, so that's the measurement we're talking about. Now the other measurement is related to the insertion. So can you open really wide and try and lift your tongue up for me? And you can see now that if I use this side of the ruler, from the insertion of the tongue to the tip of the tongue, you can see that also is reduced. The other thing I want you to see here, when Christopher tries to lift his tongue up, the tip of the tongue forms a V. That's a classic example of tongue tie. So if you open really wide and try and lift your tongue up, that's only as much as you can lift his tongue up. So that's a classic grade 3-4 tongue tie. Now, if we look at the upper arch, thanks Lisa, you can see here how narrow his upper arch is, and where does it roll in the premolar region, because the buccinator or the cheek muscle, that's where it exerts most of its pressure. So if the tongue's not there doing its job, the buccinator muscle pushes, and that's how Christopher gets this crowding. Christopher, just bite together, and what Christopher's talking about is a crossbite. If you look on this side, Christopher's top teeth fit inside his lower teeth, whereas a normal bite, all those teeth should be over the lower teeth. So we'll resolve Christopher's crowding by expanding the upper jaw, but at Christopher's age, it's harder to expand because the jaw's not growing anymore. And what I'm trying to say is if someone had picked up his tongue tie early, trained him to put his tongue up on the palate, which is called oral myology, then he wouldn't have this narrow arch and may not even have crowding. So that's why it's important for speech pathologists and for dentists to work together to examine range of motion of the tongue and width of the palate. So if we look at the width of Christopher's palate, the intermolar distance is actually less than it should be. The ideal measurement would be about 37 millimeters, or the width of a cotton roll. His is much lower than that, and that's why we need to widen it to give him a proper bite. Okay. So now that I've looked inside Christopher's mouth, I'm going to try and explain to him, as a patient who doesn't know about tongue tie or why he has a crowded jaw, why the two are related. And then obviously then when I do a treatment plan, the patient understands a bit more what we're trying to do and why I need to work with an oral myologist to lift the tongue up. So what will normally happen, we widen the palate first, then we release the tongue tie. Because if you release the tongue tie now, he still can't get his tongue up because the room's not there. So I widen the palate first, and we use an expander for that, a special type of expander for an adult. And then we do exercises so Christopher can raise his tongue up, which maintains my expansion, but helps his speech as well. Okay, so Christopher, an upper jaw should look like this, and it forms that way because the tongue is designed to rest up on the palate. Now, if the tongue is not there for whatever reason, in your reason because of the tongue tie, but some kids suck their thumb, other kids can't breathe through their nose, so their mouth's always open, but the buccinate or the cheek muscle is then exerting negative forces on the palate. And those negative forces are in this region where the frenum is, which I showed in your mouth. So that's actually your mouth, not your actual mouth, but that's what it looks like. So that has a roll-on effect on the bite, and that's why you have a crossbite, right? So what we're going to do is look at widening your upper jaw, but the way we're going to widen it is using a device to widen the palate, not the teeth. So at your age, if I widen your teeth with an expander like kids have, your teeth will just go tipping, and because there's no bone, they'll just squeeze back in again. So instead, we use a technique called MSE, and I'm just going to show you that now. So we're talking about expansion. The palate is the floor of the nose. Okay. So we find by widening, even though we're doing it for you for speech and for crossbite, it will actually help with your nasal breathing. So this is again a paper that's come from Stanford, and they talk about a technique called dome. And dome is widening of the palate in an adult. Right? So what's happening here, this is someone who has a narrow palate but not crowded like yours. And if you look at the other side of that palate, it is effectively the nasal cavity. So as a kid, I could expand your jaw easily because your suture of your palate is kind of wide open, right? But as an adult, I've got to put these little screws in the bone, some with local anesthetic. And then as we widen, can you see how the palatal floor drops down? So here is a V-shaped palate, so that's going to affect the nasal breathing. Here, the palates drop down. So that's what we do for you. So for you, you then get a normal bite. And let's just explain what a normal bite is up here. So this is very much like your palate. And what we saw in your mouth is the cheek has been pushing here. That's why you find your tongue rubbing against here. Now, this is a patient who's had the expansion, and can you see the change in the palate? So now the tongue is going to be happier. Now, from a chewing perspective, you have what we call a crossbite. Now, a normal bite is just like a shoebox. The lid is just over the box, and as you chew, all the teeth contribute. Whereas when you have a crossbite, the teeth that should be chewing are leaning in. So that's kind of what we see in your mouth. So the benefit of the expansion is, number one, to make room for your tongue, help your speech. Number two, to give you a more normalized bite. And then we have the added benefit because I'm changing the palatal floor of the breathing. So better speech, obviously straighter teeth and a wider smile. And better breathing. That's why we would like to treat your crowding not by pulling teeth out, but by widening your jaw. But you know, if and when you have kids, you know, have a look at their tongue early and their breathing. And you know, it's really important that a kid is sleeping with their lips together, because with your lips together and you breathe your nose, your tongue sits on your palate. You see, when you mouth breathe,
Yeah.
the tongue
I
goes
didn't have
down.
space with my.
Yeah, and I think that's why there's a contribution for you from the tongue tie as well as the nasal breathing. Yeah. Okay. Well, thank you very much for coming in, and we'll look after you. And maybe it'd be good as a plan B or part B of this video. We'll see Christopher after we finish the extended.